power ego and a single mistake can cost a life in the operating room. When a hotshot civilian surgeon humiliated and banished a veteran trauma nurse to cover his own fatal error, he thought he'd won. He never expected the base commander to wake up and demand her back. The rhythmic, high-pitched beep of the heart monitor in Operating Room 4 was the only sound cutting through the thick, suffocating tension. At Joint Base Andrews Medical Center, pressure was the default state of existence. But today, the atmosphere was downright toxic. Evelyn Parker stood on the right side of the operating table, her gloved hands slick with blood. At 32, she was a veteran trauma nurse who had spent 2 grueling tours in Afghanistan. She knew the chaotic, unyielding reality of battlefield medicine. She had held the lives of young soldiers in her hands while mortar fire shook the ground beneath her. She possessed a sixth sense for trauma, an intuition forged in the fires of active combat zones. Across the table stood Dr. Harrison Montgomery, the hospital's newest acquisition. Montgomery was a civilian contractor, a brilliant but notoriously arrogant cardiovascular surgeon, headhunted from a prestigious private hospital in Boston. He wore his bespoke tailored scrubs like a tailored Italian suit. Montgomery was brought in to elevate the base's surgical department, a fact he made sure everyone was acutely aware of. He was a man accustomed to pristine operating theaters, compliant staff, and absolute unquestioned authority. On the table between them lay Corporal James Miller, a 22-year-old engineer who had been crushed under a collapsed heavy-duty transport vehicle during a routine training exercise. His pelvis was shattered, and his internal bleeding was massive. "More suction!" Montgomery snapped, his voice muffled by his surgical mask, but dripping with irritation. "And get me another clamp. You people move like molasses." Evelyn complied instantly, maneuvering the suction tube with practiced precision. However, her eyes remained fixed on the ultrasound monitor positioned just above Montgomery's shoulder. Something wasn't right. The pooling blood in the lower abdomen wasn't just coming from the visible arterial tear Montgomery was aggressively trying to isolate. There was a dark, spreading shadow near the spleen, a secondary retroperitoneal bleed that was rapidly expanding. "Doctor," Evelyn said, her tone calm but urgent. "His pressure is dropping, 70/40 and falling. I'm looking at the scan, and there's a secondary hemorrhage near the splenic artery. If we don't pack that quadrant immediately, we're going to lose him to hypovolemic shock before you can tie off that primary bleeder." Montgomery paused, his hands hovering over the open surgical field. He slowly raised his head, fixing his cold gray eyes on Evelyn. The rest of the surgical team, an anesthesiologist, a scrub tech named Brian, and a junior circulating nurse froze. "Nurse Parker, is it?" Montgomery asked, his voice dangerously low. "Yes, doctor," Evelyn replied, not breaking eye contact. "We need to pack it now. The pressure is dropping too fast." "I was unaware," Montgomery said, his tone laced with venomous sarcasm, "that a nursing degree granted you the expertise to interpret a real-time sonogram and dictate surgical procedure to a physician with 20 years of specialized reconstructive experience. Are you the lead surgeon on this case? Nurse Parker, no doctor, but in combat trauma. This isn't a dusty tent in the desert." Montgomery barked, his temper flaring. "This is my operating room. I am isolating the iliac tear. Do not interrupt me again. Suction." Evelyn held her ground. She had seen this exact pattern of internal bleeding before in Kandahar. She knew that if he clamped the iliac artery without addressing the splenic bleed, The sudden change in vascular pressure would cause the spleen to rupture, entirely flooding the abdomen and killing the young corporal in minutes. Dr. Montgomery, with all due respect, if you clamp that now, he will bleed out on this table. Evelyn insisted, her voice rising above the rhythmic alarms of the vital monitors. I am recommending immediate packing. Montgomery's face turned crimson beneath his surgical cap. He threw his bloody forceps onto the metal tray with a loud ringing clatter. How dare you! How absolutely dare you question my medical judgment in the middle of a procedure? He pointed a trembling gloved finger at the operating room doors. Get out! Silence fell over the room, save for the frantic beeping of the corporal's failing heart. Doctor, we don't have time for this, the patient. I said get out! Montgomery roared, his voice echoing off the sterile tile walls. Security, someone call the MPs. I want this insubordinate amateur removed from my OR immediately. I will not have my focus broken by a glorified bedpan changer. The junior nurse nervously reached for the wall phone. Evelyn looked down at the young soldier on the table. Leaving felt like signing his death warrant, but staying would only delay the surgery further, as Montgomery was clearly willing to let the clock run out just to prove his dominance. You're making a mistake, Evelyn said softly. She stripped off her bloody gloves, tossing them into the biohazard bin. As she backed away from the table, she looked at the anesthesiologist, Dr. Robert Sterling. Watch his left quadrant, Bob, please. As Evelyn pushed through the swinging doors of OR 4, the cold air of the hallway hit her flushed face. She leaned against the wall, her heart hammering against her ribs. 2 military police officers arrived minutes later, looking confused, as they were ordered by the circulating nurse to escort Evelyn to the chief of medicine's office. Humiliation burned in Evelyn's chest, but it was quickly overshadowed by a sickening dread. 30 minutes later, while sitting in the administrative waiting area, she saw a code blue team rush down the hall toward OR 4. Corporal Miller had crashed. Montgomery's ego had just cost a young man his life, and Evelyn knew with absolute certainty who the arrogant surgeon was going to blame. By 0800 hours the next morning, the hospital's rumor mill had already convicted Evelyn Parker. Dr. Harrison Montgomery was a master of political maneuvering. Before Corporal Miller's body had even been transferred to the morgue, Montgomery had filed a blistering multi-page incident report. He claimed that Evelyn's hysterical and insubordinate outburst had dangerously distracted the surgical team, directly resulting in the patient's cardiac arrest. Because Montgomery was the hospital's newly minted star surgeon, the administration was desperate to protect his reputation and their own investment. Evelyn sat across from Brenda Wallace, the chief of nursing, and Colonel James Henderson, the hospital administrator. The small office felt like an interrogation room. Evelyn, you know I respect your service, Brenda said, looking genuinely pained as she shuffled the paperwork on her desk. Your record in Afghanistan is exemplary, but you directly countermanded a lead surgeon in the middle of a critical procedure. You embarrassed him in front of the entire staff. I was trying to save the patient's life. Brenda, Evelyn said, keeping her voice remarkably steady, despite the fury boiling inside her. Montgomery missed the secondary hemorrhage. He was tunnel-visioned on the pelvic crush. If you look at the autopsy report, you'll see the spleen ruptured, exactly like I said it would. Dr. Montgomery's report states the rupture was an unavoidable complication of the crush injury, exacerbated by the delay caused by your interference. Colonel Henderson interjected, his tone bureaucratic and cold. Nurse Parker, Dr. Montgomery is threatening to break his contract and leave the facility if you remain on his surgical rotation. We cannot afford to lose him." Evelyn stared at the colonel in disbelief. "So you're going to let a surgeon bury his fatal mistake because he has a shiny resume? He killed that kid, Colonel." "Watch your tone, Lieutenant," Henderson snapped, pulling rank. "Pending a full medical board review, you are stripped of all surgical and trauma duties. You will report to the subterranean logistics wing. You are on inventory and supply management until further notice. Consider yourself lucky you aren't facing a court-martial for insubordination." For the next 3 weeks, Evelyn existed in a state of purgatory. The basement supply depot was a windowless, dusty labyrinth of medical equipment, miles away from the adrenaline and purpose of the trauma bays. She spent her shifts counting boxes of saline organizing intubation kits and checking expiration dates on surgical mesh. Her colleagues upstairs stopped making eye contact with her in the cafeteria. To the rest of the base, she was the rogue nurse who had cracked under pressure and ruined a surgery. Evelyn seriously considered resigning her commission. She drafted her resignation letter dozens of times in her head while staring at rows of sterile bandages. The injustice of it all ate at her, gnawing away the passion she had always held for medicine. But a storm was brewing above ground, one that no amount of ego or hospital politics could control. It happened on a rainy Tuesday afternoon. The sirens across the sprawling military base began to wail a deafening, oscillating pitch that signaled a mass casualty event or a high-value emergency. Down in the basement, Evelyn's two-way radio crackled to life with frantic, overlapping voices. Code red in the trauma bay. All available hands to the ER. Evelyn instinctively dropped her clipboard and grabbed the radio, her heart rate spiking. She listened as the chaotic chatter painted a horrifying picture. A Black Hawk helicopter had suffered a catastrophic mechanical failure during a low-altitude transport drill, crash landing hard on the tarmac. There were multiple casualties, but one name on the radio frequency made Evelyn's blood run cold. "Inbound ETA, 2 minutes. We have Base Commander General William Hayes. Massive blunt force trauma, suspected internal hemorrhaging. Unresponsive at the scene." General William Hayes was a legend in the military community. A grizzled, fiercely respected combat veteran, he was known for leading his troops from the front lines in Fallujah. He was also the man who years ago, in a dusty field hospital in Kandahar, had trusted a young nurse, Evelyn Parker, to keep him alive when his convoy hit an IED. Upstairs, the emergency department was a war zone. When the paramedics wheeled General Hayes through the double doors, the room descended into controlled chaos. The general was pale, his uniform soaked in blood, his breathing ragged and shallow. Dr. Harrison Montgomery strode into the trauma bay, flanked by an entourage of junior doctors. He looked annoyed by the disruption to his afternoon schedule. "All right, clear a path," Montgomery barked, snapping his gloves on. "Let's see what we have. Get him typed and crossed for 6 units push epi, and get a portable X-ray in here now." As the team swarmed, the General Montgomery began his assessment. "Obvious flail chest, likely pulmonary contusions. I need him prepped for immediate thoracic surgery. We'll open him up, repair the lung, and stabilize the ribs." "Doctor," a young terrified resident stuttered, looking at the monitor. "His heart rhythm, it's highly irregular. He's going into V-fib." "Then charge the paddles, you idiot," Montgomery yelled, grabbing the defibrillator paddles himself. "Clear." The general's body arched off the table, but the monitor continued to emit a frantic, erratic screech. Again clear. Montgomery shocked him a second time. Nothing. The rhythm was wildly chaotic, defying standard advanced cardiac life support protocols. Montgomery was sweating now. The confident, arrogant veneer was cracking. This wasn't a standard civilian heart attack. This was a complex failing system, and the most powerful man on the base was dying under his hands. Standing in the corner of the room, observing the chaos, was Colonel Jonathan Miller, the general's fiercely loyal chief of staff. He had ridden in the ambulance with the general. Miller knew General Hayes's extensive classified medical history, a history that wasn't in the standard digital file Montgomery had casually glanced at. "Dr. Montgomery," Colonel Miller shouted over the noise, "standard defibrillation won't work. He has a specialized experimental biventricular pacemaker implanted near his spine from a shrapnel injury in Iraq. You're overriding the system. You're frying his heart." Montgomery froze the paddles, still in his hands. What that wasn't in his chart. I don't know the frequency to bypass a specialized spinal implant. I need a cardiothoracic electrophysiologist. "We don't have one on base." Brenda Wallace cried out, her hands covered in the general's blood as she applied pressure to a wound. The room ground to a terrifying halt. Montgomery, the brilliant, highly paid savior of the surgical wing, stepped back from the table, his eyes wide with genuine panic. He had no idea what to do. The base commander was slipping away, the monitor's jagged lines flattening out. Suddenly, Colonel Miller lunged forward, grabbing Brenda by the shoulders. "Where is she? Where is Parker?" Brenda blinked, bewildered. "Evelyn, she's in the basement. She was suspended from—" "I don't care what she's suspended from," Miller roared, his voice shaking with desperation. "The general gave me strict standing orders. If he ever went down, if he ever ended up on a table in this hospital, I was to get the nurse who saved his life in Kandahar. She's the only one who knows the exact sequence to bypass his pacemaker manually. Get her up here now, or so help me. God, I will burn this hospital to the ground." Down in the concrete subterranean depths of the medical center supply depot, the harsh, flickering fluorescent lights buzzed overhead like a swarm of angry hornets. Evelyn Parker was in the middle of meticulously logging expiration dates on a towering, shrink-wrapped pallet of intravenous saline bags. The monotony of the task was suffocating, a stark contrast to the adrenaline-fueled environment she was trained for. Suddenly, the heavy industrial wall phone shattered the quiet. It wasn't the standard digital chime of the hospital intercom. It was the abrasive, jarring ring of the red emergency line, a relic from the Cold War era designed to bypass all hospital switchboards during a critical mass casualty event. She snatched the receiver off the wall, her instincts instantly taking over. "Parker," she answered, her voice tight and strictly professional. On the other end of the line, Brenda Wallace, the chief of nursing, was hyperventilating. The background noise was a cacophony of shouting voices and blaring medical alarms. "Evelyn, you need to get to Trauma 1 immediately. Right now. It's General Hayes. He was in a helicopter crash. Montgomery just shocked him with the defibrillator, and the general's specialized pacemaker is shorting out. He's in ventricular fibrillation. Colonel Miller is threatening to have the military police arrest the entire surgical staff if you aren't up here in 60 seconds. We are losing him. Evelyn." Evelyn didn't waste precious oxygen asking questions. She dropped her metal clipboard, the sharp clatter echoing loudly off the linoleum floor, and sprinted for the heavy freight elevator at the end of the corridor. She hammered her fist against the rusted metal call button, her mind racing back through time to a blood-soaked makeshift surgical tent in Kandahar 5 years ago. General William Hayes, who had been a colonel at the time, had been brought into her unit with a shredded chest and a jagged piece of mortar shrapnel lodged perilously close to his spinal cord. During the grueling, chaotic medevac, a highly specialized experimental biventricular pacemaker had been inserted by a DARPA field surgeon to keep the man's failing heart beating. Evelyn had been the nurse tasked with maintaining it during the transport, memorizing the bizarre, classified sequence of magnetic overrides and specific electrical inputs required to reset the delicate machinery if it ever failed. It was meant to be a temporary battlefield fix, but the device had become a permanent part of the general's anatomy, a closely guarded secret known only to the general himself, his loyal chief of staff, and the trauma nurse who had refused to let him die through the darkest, most desperate night of his military career. The freight elevator doors finally parted with an agonizingly slow groan, and Evelyn bolted down the pristine white corridors of the main hospital floor. She slammed through the swinging double doors of the emergency department, the chaotic din of advanced trauma care hitting her like a physical shockwave. Trauma 1 was a scene of absolute terrifying pandemonium. General Hayes lay flat on the stainless steel table, his skin an ashen, lifeless gray. The monitors above his head were screaming a continuous erratic alarm that signaled impending cardiac death. Dr. Harrison Montgomery stood frozen by the head of the bed, the heavy defibrillator paddles dangling limply from his trembling hands. The usually immaculate, arrogant surgeon looked small and entirely stripped of his god complex. He was paralyzed by the sheer naked terror of a man who suddenly realized he was entirely out of his depth. Beside him, Colonel Jonathan Miller was dangerously close to drawing his sidearm, his face inches from Montgomery's. Step away from the table. Dr. Colonel Miller barked his voice, carrying the lethal, unyielding authority of a career military officer. Montgomery blinked, stammering defensively. "I am the chief cardiovascular surgeon of this facility. You cannot order me." Evelyn violently shoved her way through the paralyzed, terrified medical team, grabbing a pair of sterile surgical gloves from the wall dispenser and snapping them over her wrists. "Move, Montgomery!" she commanded, her voice cutting through the panic with icy, absolute precision. She didn't wait for his compliance. She physically shouldered the high-priced civilian contractor out of the way. Montgomery stumbled backward, hitting a stainless steel instrument tray with a loud crash. "Nurse Parker," he gasped, his face flushing with a chaotic mix of outrage and profound relief. "You are officially suspended. You have absolutely no medical authority in this room." Colonel Miller cut him off with a vicious, silencing glare. "She has my authority, Doctor. Shut your mouth and step back, or I will personally have the MPS drag you out of this hospital in handcuffs for treason." Evelyn ignored the posturing and the politics. Her eyes were locked exclusively on the monitor and the dying man on the table. "Brenda, I need a high-frequency medical magnet, the heavy-duty one from the MRI preparation room. Now," she shouted, her voice echoing off the tile. "And draw up 50 milligrams of amiodarone. Push it fast, followed by an immediate saline flush. We have exactly 40 seconds before his brain is deprived of oxygen, past the point of no return." Brenda, galvanized by Evelyn's commanding presence, sprinted toward the secure supply cabinet. Evelyn placed her bare hands flat on the general's chest, feeling the chaotic, terrifying flutter of his failing heart beneath his broken ribs. It felt exactly like a bird trapped in a cage, frantically beating its wings before collapsing into exhaustion. She closed her eyes for a fraction of a second, tuning out the noise, the hospital, and the arrogant surgeon behind her. This wasn't a sterile hospital in Maryland anymore. This was the unforgiving desert, and she was going to bring him back. Brenda rushed back and slapped the heavy circular medical magnet into Evelyn's waiting hand. "Amiodarone is in," the junior nurse confirmed, pushing the syringe with trembling fingers. Evelyn leaned over the table and positioned the heavy magnet over the general's left shoulder blade, exactly over the subcutaneous insertion point of the spinal leads. "Everyone step back and clear the bed," she ordered. She tapped the magnet against the skin in a highly specific irregular rhythm. 3 short rapid taps, an agonizingly long 5-second hold, and 2 final sharp taps. It was a manual override sequence designed by military engineers, a protocol completely absent from standard civilian medical textbooks. The entire trauma room held its collective breath. The chaotic, jagged scribbles on the heart monitor suddenly flatlined. A horrific, sustained singular beep filled the silent room. Montgomery let out a harsh, mocking breath. "You killed him, Parker. You just stopped the base commander's heart." Evelyn didn't flinch. Her hands remained steady. "Wait for it," she whispered, her eyes glued to the dark screen. 1 excruciating second passed, then 2, then 3. Just as Colonel Miller's hardened face began to crumple into devastating despair, the monitor beeped. It was a sharp, singular sound. Then another. The long, terrifying flatline jumped, forming a jagged, perfectly paced spike. Beep, beep, beep. Normal sinus rhythm. The general's chest heaved upward as a ragged, desperate breath escaped his lips. His blood pressure numbers on the digital display began to climb steadily out of the fatal danger zone. A collective gasp of sheer relief swept through Trauma 1, followed by spontaneous, breathless murmurs from the nurses and residents. Evelyn let out a long, shuddering exhale, stepping back from the operating table and wiping a bead of cold sweat from her forehead with the back of her wrist. She turned to Dr. Robert Sterling, the anesthesiologist from Corporal Miller's botched surgery, who had just rushed into the room upon hearing the code red. "Bob," Evelyn said, her voice steady and resolute. "His rhythm is locked in, but he has massive internal bleeding and severe pulmonary contusions. He needs immediate thoracic repair. Can you get Dr. Gregory Harding down here right now?" "Harding is scrubbing in as we speak," Dr. Sterling confirmed, casting a deeply satisfying, entirely disdainful look at the disgraced Montgomery. "We're bypassing the cardiovascular department and going straight to the military trauma surgeons. You did it, Evie. You saved him." The subsequent surgery lasted for 7 grueling, blood-soaked hours. Dr. Gregory Harding, a seasoned, no-nonsense military trauma surgeon, meticulously repaired the devastating blunt force damage to the general's lungs and expertly stabilized the shattered flail chest. Evelyn remained fiercely by the general's side in the intensive recovery wing the entire time, meticulously monitoring the complex temperamental pacemaking system. She adamantly refused to yield her post to anyone, drinking bitter black coffee and watching the steady rise and fall of the commander's chest. During those long, tense hours in the dark, the atmosphere within the hospital began to undergo a massive seismic shift. The unbelievable story of what had transpired in Trauma 1 spread like wildfire through the corridors, becoming a blazing inferno of hospital gossip that ruthlessly incinerated Dr. Harrison Montgomery's carefully constructed, arrogant reputation. The nurses, the scrub technicians, and the junior doctors, everyone who had suffered in silence under Montgomery's tyrannical, degrading reign suddenly began to speak up. Whispers in the break room quickly turned into formal documented complaints. More importantly, the previously terrified and silent witnesses to young Corporal Miller's tragic death finally found their courage. The invincible, untouchable civilian contractor had shown his true colors under the crushing pressure of a real emergency, and the entire medical staff had watched him crumble into incompetence, while the unjustly exiled trauma nurse stepped up and saved the day. 3 days later, as the morning sun broke through the heavy rain clouds, General William Hayes finally opened his eyes. The VIP recovery suite was dim and quiet, save for the rhythmic, reassuring hum of the life support monitors. Evelyn was sitting in a vinyl chair by the window, quietly charting his morning vitals on a tablet. The general blinked against the harsh fluorescent light, his gaze shifting slowly around the unfamiliar room until it locked onto Evelyn. A weak, raspy chuckle escaped his dry throat, immediately followed by a sharp wince of pain from his fractured ribs. "Parker," he rasped his voice, barely more than a gravelly whisper. "Why is it, every single time I try to die, you're always the one standing there in my way?" Evelyn looked up, a genuine warm smile breaking through the heavy mask of exhaustion she had worn for 3 days. She walked over to the side of his bed, gently adjusting his intravenous line and checking his pulse. "Someone has to keep you in line, sir. You have a terrible, expensive habit of breaking perfectly good military helicopters." The general's tired eyes softened with profound, unspoken gratitude. He took a slow, painful breath. "Colonel Miller told me what happened while I was under. He told me about you being banished to the basement. He told me about the civilian doctor who nearly fried my heart." The general's jaw tightened the familiar, terrifying authority, returning to his demeanor despite his severe injuries. "Fetch me my chief of staff, lieutenant. We have a mess to clean up." The resulting reckoning came swiftly, and it came without a single shred of mercy. General Hayes, even while confined to a hospital bed with tubes in his chest, wielded absolute, uncompromising authority. Within 24 hours of his awakening, a full military tribunal and an independent medical board inquiry were officially convened to investigate the surgical department. Dr. Robert Sterling, the anesthesiologist, was the first to step forward. He formally and aggressively retracted his previous administratively coerced statement regarding Corporal Miller's botched surgery. He testified under oath that Evelyn had correctly and swiftly diagnosed the fatal splenic hemorrhage on the ultrasound, and that Dr. Harrison Montgomery had willfully, stubbornly ignored her accurate warnings, prioritizing his massive ego over the young soldier's rapidly deteriorating condition. The initial autopsy report of the corporal was immediately seized and re-examined by a team of independent, out-of-state military medical examiners. Their findings confirmed Evelyn's initial assessment beyond a shadow of a doubt. Colonel James Henderson and Chief of Nursing Brenda Wallace were unceremoniously called before the base commander's investigative committee. Brenda broke down in tears, expressing deep, profound remorse, admitting she had cowardly yielded to intense administrative pressure to protect a high-value, highly paid civilian contractor. Because of her previous good record, she was allowed to keep her license, but was demoted from her administrative role. Colonel Henderson, however, found himself formally reprimanded, stripped of his comfortable administrative authority, and quietly, swiftly transferred to a desk job in a freezing remote logistics outpost in northern Alaska. The hospital administration's desperate attempt to bury a fatal surgical mistake had been violently and publicly unearthed. As for Dr. Harrison Montgomery, His departure from Joint Base Andrews Medical Center was devoid of any grace or dignity. His lucrative multi-million-dollar contract was terminated with immediate prejudice. The formal charges cited gross medical negligence, cowardice under extreme pressure, and intentionally falsifying official incident reports to cover up a preventable death. As Montgomery was escorted off the military base by the very same stern military police officers he had once smugly called to remove Evelyn from his operating room, he looked incredibly small, broken, and entirely defeated. His designer scrubs were gone, replaced by civilian clothes that seemed to hang off his suddenly diminished frame. He was now facing a ruthless civilian medical board review that would almost certainly strip him of his surgical license permanently, and the grieving family of Corporal Miller was preparing a massive, inescapable, wrongful death lawsuit with the full backing and legal support of the United States military. Evelyn Parker, on the other hand, experienced a very different kind of reckoning. Exactly 1 month later, she was officially summoned to General Hayes's newly rebuilt office. Standing at perfect military attention in her pristine dress uniform, she was proudly awarded the Meritorious Service Medal in front of the entire cheering hospital staff. But more importantly, she was officially named the new head of trauma nursing for the entire medical center, given absolute authority over emergency surgical protocols. As she confidently walked back into OR 4 that afternoon, snapping on her sterile surgical gloves for a complex procedure, the room fell completely silent. But this time, it wasn't a tense silence born of fear or intimidation. It was a silence of absolute, unquestioned respect. If you were on the edge of your seat during this incredible story of justice and medical drama, make sure to hit that like button. Don't forget to subscribe and turn on notifications so you never miss out on these intense real-life stories. Share this video with a friend who loves a good comeback story and drop a comment below telling us what you would have done in Evelyn's shoes. Thanks for watching, and we'll see you in the next one.